Hi, good evening, everyone. So today we'll have a discussion based on your traumatic brain injury, which would be an image-based discussion, right? So the basic motto of this class would not to be provide you a lot of information, but to make you orient with the various CT scans that we come across in our clinical practice, so that it becomes easier for you to identify your diagnosis in your exams as well as in your clinical practice if you come across. So instead of taking those standard images from the book, what I have done is that I have taken some images which I had come across in my trauma care center. So before going into that, so let's understand like what are we trying to going to look at. So when we talk about your traumatic brain injury, so we are going to have basically two main groups over here, right? So first would be your skull fracture. Now, in skull fracture, it can be closed injury or it can be open type of injury. Then we can have our intracranial lesions. So, when you talk about this intracranial lesion, we can further divide it into two groups. That would be your focal, and we have another which is your diffuse. So when you talk about focal, what do we come across over here? We'll come across contusions and then hematoma. Now, when we talk about hematoma, what types of hematoma do we see? We see EDH. EDH, that is your extradural hematoma. And then we have your SDH, that is your subdural hematoma. And in traumatic cases, we also sometimes find your contusions, or basically you can say ICH, or we have your SAH, that is a subarachnoid hemorrhage, or your interventricular hemorrhage. Now, when you talk about your diffuse lesions, so over there you have your DI, that is a diffuse axonal injury, and you can have your contusions, which can be multiple, right? So it can be a focal contusion or it can be multiple contusion. So now let's not have a lot of theoretical discussion on this, rather move on to the images. So we have this first CT. So students, I would want you all to see this CT and come down to a diagnosis to what you can see. So you need to find out what is the pathology over here. So if you carefully look over here on the left side, so how do you identify which is right or which is left? A very simple trick. Look at this particular, this is your scout image, right? So this is going to give you a hint towards your starting point of your CT scan, right? And this particular part which I am marking over here with the blue is your right side, and one which I'm marking over here is the left side. So if you look at the pathology somewhere starts over here, right? Yes. So you can see over here, it is a convex shaped hyper, that is hyper, which is your blood, which is white, hyper dense lesions present in your left side parietal region. Now, this is your convex, biconvex shape. So this is your extradural hematoma. Right. So you're often asked in your exams or be it in your oral viva that you need to, you are given a CT scan and you need to make a diagnosis of the radiological finding on the CT. So this would be a extradural hematoma on the left side. Now, another important thing which I would want you all to remember is that when you look at the CT, don't be biased that you might be getting only one finding. In CT scan, you might be getting multiple findings. Now, if you look over here carefully, right, this were your parenchymal cuts. If you look over here in the bone cuts, you will find that there is a fracture. Now, this fracture is not a linear fracture. What do I mean by a linear fracture? A fracture which is not displaced basically. It is in one line. But if you look over here, you can see the outer table over here and the inner table, right? The two fracture lines are coming like this, right? So basically this is a depressed fracture. So the correct diagnosis in the CT scan would have actually been a left-sided parietal depressed fracture with an underlying EDH. The reason for telling and showing you the CT scan is that when you are given a CT scan, try to read to find out the pathology. Yes, definitely we have EDH, but we also do have a depressed fracture over here. Right. So now let's go on to the next image. So if you look at this image, what do we have? So we look at the hyperdensities, which are your blood. So if you look over here, start from the beginning, we have in this cut, we can see over here. So this is your right side temporal area. So you can find some hyperdensities over here. So this is the blood. Now you can also find some heterogeneous hyperdensities over here. So yes, there is blood in on the left side also. Now as you go on the further cuts, what you are going to see that, see, this is a clear convex shaped on the right side, whereas on the left side you have patchy things, right? Now, as you go down on the further cuts, you further notice, see, hyperdense, and then you have some hyperdensities over here also on the left side. So, what are we looking at? So, if you remember what we just read before in the CT, on the right side, we definitely have an extradural hematoma. Now, on the previous CT, there was an underlying depressed fracture also along with it. But over here, we on the opposite side, we have some contusions, right? So this is your left side contusion. So on a CT scan, you can find coexistence of more than one pathology. So over here, right side, we are having an EDH that is hyperdense biconvex, whereas on the left side, we have heterogeneous hyperdense lesion, which are your contusions, right? So now moving on to the next image. So if you look over here, what do we have? We can see that we have in the both side frontal lobes hyperdensity lesions. And then I have been emphasizing one word which I emphasized before in this prior CT scan, that was an heterogeneous density, right? So you can look over here, it is a heterogeneous. Now why am I focusing on your word heterogeneous? Because there is another pathology, that is your intracranial hemorrhage. Now, when we are talking about this traumatic brain injury, there could be some spontaneous hemorrhages which can be confusing, right? So there's some doubt regarding what is this black. So along with the hemorrhage, once it starts resolving, that has the surrounding edema. So this black basically, which is surrounding the white, is the edema surrounding the hemorrhage, right? So over here we have the heterogeneous. So over here we have your bilateral contusions, right, in the frontal region. So as I told you, over here we had the focus on the word heterogeneous, and there might be some pathologies which are your homogeneous. So let's look at this next image, which is going to help you differentiate. So you look over here, this particular hemorrhage, right? It is absolutely homogeneous. Now usually these are your spontaneous. Now, how would you be able to differentiate? So obviously there would be some history given to you in your clinical scenarios. Now, what are those clinical scenarios? History, the patient could be hypertensive, or patient could be an aneurysm patient, right? Following which the patient had a headache and a fall. So these are your some of the spontaneous causes of your ICH which you need to know. And yes, one of the other important causes could be your drug intake, where the patient is taking your clopidogrel and had a small trauma, but then those spectrum usually leads to your chronic SDH part, but then they can lead to your spontaneous hemorrhage also. But majority of the patients that we actually have is because of your uncontrolled hypertension. The purpose of giving this is that when you have an intracranial hemorrhage like this, that is basically a homogeneous one, right? So that is going to correspond to your ICH, right? Now you're going to differentiate it from a contusion. How? That would be basically heterogeneous. Now moving on to the next. So what do we have over here? So if you look at the city, we have something happening over here, right? So you can see there is some hyperdensity, right? You can see over here there is not a uniform bone margin present. You can see some part of the bone entering, right? So basically we are dealing over here with a depressed fracture. Now underlying EDH might not be very clearly visible, but then the hyperdensities may be taken over here as your extradural hematoma. So you can look over here how the bone fragments have been broken, right? And obviously this outside swelling that we have is your soft tissue swelling. So this is your depressed fracture, which is, we can also rather say it, a comminuted fracture, right? Like one of the fractured bone is particular entering the brain parenchyma. Now, moving on to the next city. So this one, we have your depressed fracture, right? We can say it to be a comminuted depressed fracture. Now, coming down to the next city. So if you look over here, so this was a patient who presented to our trauma care center for a road traffic accident. After your initial stabilization, we had the CT scan done. So what do you see over here? So there are a lot of findings over here, but the main things which I would want you all to know is, look at this, a crescent shaped hyperdensity over here, right? You can see this crescent shaped hyperdensity. So this crescent shaped hyperdensity, we are basically dealing with acute subdural hematoma, right? So this is one of the common traumatic conditions that we come across. So how are you going to differentiate it with EDH? So there might be cases where you might have a coexisting EDH as well as SDH. So the basic way that you would need to differentiate is on the basis of the shape of your blood. So in case of acute subdural hematoma, you have your crescent shape. Now, there are times where you might have difficulty in differentiating your acute subdural hematoma from your extradural hematoma. Why? Because sometimes on CT scan it may appear same, but then you need to try to find out how to differentiate it. So definitely shape. Now, if you're not able to differentiate it from the shape, then do remember when you talk about your acute subdural hematoma, it does cross your suture lines, whereas your EDH generally does not crosses your suture line. So this is again one of the most important points which can help you to differentiate your acute subdural hematoma with extradural hematoma. Now I have this one last image. So this particular image has a lot of finding. So as I told you, one CT scan can have a lot of coexisting pathology. Now the purpose over here is so that you start getting yourself oriented with this images, which is going to help you to make diagnosis. What usually happens with us is that we keep on reading the images shown in our textbooks, but then the clinical scenario sometimes it's very different. So can you guys tell me what are we looking over here? So this was again a traumatic brain injury case. So if you look over here, the findings, the first one that I can grossly see, this big contusion. Why I am seeing it to be a contusion? Because see, it is not homogeneous, right? It is actually heterogeneous, so I can say it to be a contusion. Also, other factors that are helping me to tell is, see, if you look over here, this is a depressed fracture. You can see a chunk of bone has gone inside and compressing the brain. So this actually could be the source for this confusion. So we also have a depressed fracture, right? And again, this is a comminuted depressed fracture, right? So this were the two findings which you had already seen. But now I would want you all to focus inside the ventricles. So this black ones, which we have the ventricle, you can see hyperdensity over here. That means there is blood inside the ventricles. So that is what is intraventricular hemorrhage. Right. Now, again, another finding that I want you all to show over here is, see, this are your again hyperdensities in your sulci and gyri, right? Basically your subarachnoid spaces, like you can see between your sulci gyri, the small spaces which are filled with blood. Now in order to appreciate it, you can see over here there was no such hyperdensities, right, in your subarachnoid spaces. You can see those are quite clear, right? Now, whereas in this particular scan, if I zoom it for you, you can see there is blood, right, in this subarachnoid spaces. So that is your subarachnoid hemorrhage. Now, why it is important that you need to know, because we often associate subarachnoid hemorrhage with aneurysm. But I would want you all to remember the most common cause of subarachnoid hemorrhage is actually trauma. When you talk about aneurysm, that is the most common cause of spontaneous subarachnoid hemorrhage, right? So this is another important finding of yours in your CT scan, that is subarachnoid hemorrhage. Right. So this were your few CT scans which I had selected from my clinical uh, collection. So I hope this helped. So before wrapping up, again, I shall make you go through them. So again, the basic purpose of this class is to orient you to the basic imaging and not to give you a lot of information, because that we often usually always have. We tend to make mistake in your basic diagnosis. So this particular series scan which shows us a hyperdense extradural biconvex shaped collection, that is your extradural hematoma. Now it also has a depressed fracture on the left side, right? Then we have the neck CT which has on the right side a biconvex shaped hyperdensity, which is your extradural hematoma, and a heterogeneous hyperdensity on the left side which corresponds to your contusion. So similarly over here we have bilateral contusions which are again heterogeneous. Now you might be confused with a homogeneous contusion. Those are usually spontaneous and usually seen in your hypertensive conditions, right? And then we have again your depressed fractures, right? Your so depressed fracture, you need to remember the fractures can be linear. Now when I say your linear fracture, so how would a linear fracture in a CT scan would look like? You can imagine something this, and a fracture might be over here and this continuity. Basically there is no inward uh, pressure on the brain, and there's no fracture segment getting displaced, right? And along with this depressed fracture you can have your underlying EDH, and along with that we can have underlying contusion as we had seen in the last image, right? So this is again your acute SDH. Now how are you going to identify your acute SDH? That is via your crescent shaped hyperdense collection, right? An important point to differentiate it from extradural hematoma, that it would cross your suture lines, that is your acute subdural hematoma crosses your suture line, whereas your extradural hematoma does not cross the suture line, right? And then we have this where I image where I showed you the presence of subarachnoid hemorrhage. Then if there is blood inside the ventricles, that would be your interventricular hemorrhage. Along with the depressed fracture we discussed, there was EDH, but then over here we have an underlying big contusion. And also in cases of trauma, we might have your subarachnoid hemorrhage. It's not necessary that they're only going to be seen in aneurysm. And as a matter of fact, trauma is your most common cause of subarachnoid hemorrhage. Right. So this was just some of the most important CT findings that are often asked in your entrance exam, be in your Viva table, as well as something that you would come across routinely in your emergency. Right. So if you have any doubts, happy to help. Please do reach out. Thank you.
Recording stopped.